Youth are a vulnerable population from a societal point of view. They have yet to develop strong coping skills to survive difficult situations. And even if they have some coping skills, they likely do not have the knowledge to know where to seek out resources to help them overcome challenges such as suicidal ideations. Youth at the highest risk of committing suicide are also often the least likely to seek help for that situation. Many of these youth can be living in very challenging situations and unstable homes where they lack the basics to maintain a certain quality of life. Although the government of Canada has pledged to develop and implement a national suicide prevention strategy, leaders in Indigenous communities argue that the responses to the suicide clusters that are occurring are too short lived and that there is a lack of a long term targeted solution to get to the root of the problem and to have a more holistic approach to the situation and all of the contributing factors. They have requested that there be permanent supports in their communities on evenings and weekends, because those are the most critical times when individuals are the most likely to attempt suicide. The question of quality of living should be addressed by the government. Providing clean drinking water and appropriate housing would bring more stability to these communities. These communities have also mentioned a lack of funding across school systems, healthcare, and child services. An increase in funding to these services would lead to greater protective factors for youth who are at risk of suicide. These factors could all universally contribute to reducing the risk factors that are related to suicide for youth in these communities.